Gauteng's health department says it doesn't have the money to retain all 8,500 medical workers brought in during the height of COVID-19. This comes after a picket at the Chris Hani Baragwanath Hospital by staff over challenges at the facility. The hospital CEO, however, dispelled reports of food shortages. Lindokuhle Xulu has this story.
Staff picketed outside one of Gauteng's biggest hospitals over job cuts, reports of patients going without food and other challenges. This brought the province's health department to the Chris Hani Baragwanath Hospital to answer to the concerns.
Honestly speaking, the department is not in a financial crisis, and that we must state openly. The one thing that we should take note of is the fact that funding for health is one of the key priorities in the province.
This picket outside Bara was calling for COVID-19 staff to be retained. The department says the 8,500 contract workers were hired on a budget grant and that not all of them can be accommodated in the new financial year. Despite this, Bara's CEO eNCA says the cut from the 800 extra hands will be felt.
Based on the budget allocation that we had, remember the DG spoke about 2.2 billion that we had on recruitment of these personnel. There's about 1.1 billion that is now going to be given for the year 2022-23. That is the year that's starting now in April the following month. So we can only talk to plus minus 50% of what we can now employ as part of recruitment process for COVID-19 patients.
We are the biggest hospital in the country and in the southern hemisphere, so we just don't have enough hands, to man the workload that we have to carry. So there is a need for the staff establishment to be reviewed, and that is a fact.
On the issue of food shortages at the hospital, Lucia says the challenge was with a bread service provider and that patients were not starved.
Patients, I think they prefer to have bread. The community that we serve, they prefer bread. So even if you gave them alternatives, the unhappiness about bread still remained. But as a hospital, we had mitigation strategies in place. For example, we are procuring bread from using petty cash. We are also baking bread in our own kitchen. But as the principals have already said, the supplier has been paid, and we do hope that going forward we'll receive a delivery of bread.
The remaining budget for Gauteng's health department is at 10 billion. The department has assured that this is enough till the new financial year. Lindokuhle Xulu, Johannesburg.